In this video, our subject is dementia. We will discuss an introduction to dementia, common behaviors in people with dementia, how to manage difficult behaviors, how to care for a person with dementia, and how to cope with the stress of caring for a person with dementia. Dementia is a disorder that is devastating not only to the person who suffers from it, but also to the person's family members. It's devastating not just because the care that dementia requires is so physically demanding. For families, dementia care is also mentally exhausting because they must watch the person they love grow more and more distant, changing before their eyes into a stranger, a person who can no longer recognize even her closest loved ones or perform even the simplest tasks for herself. So you can see how caring for a loved one with dementia at home can be a very heavy burden for most family members. That's why they look to others for help, with the result that more than half of all residents in long-term care facilities are there because they have dementia, can no longer take care of themselves, and can no longer be cared for at home by family members. As a nursing assistant myself, I understand that many of my patients and residents who suffer from dementia are unaware of what I'm doing for them, but their loved ones know, and they appreciate what I'm doing, and that makes me feel pretty good inside. Dementia is the permanent and progressive loss of the ability to think, reason, and remember. Dementia is caused by damage to the brain tissue. There are many different types of dementia. Although Alzheimer's disease is the most common type of dementia, all people with dementia experience problems with memory, especially short-term memory, problems with judgment leading to poor decision-making, difficulty putting thoughts together, understanding concepts or solving problems, and disorientation as to person, place, or time. A person in the early stages of dementia may seem simply forgetful. However, the disease is always progressive and inevitably fatal, and the person will need increasingly more help with basic activities such as grooming, bathing, and toileting. Eventually, the person dies as a result of the disease. People with dementia often show a wide range of behaviors, especially as the dementia progresses. Let's review some of the behaviors that are commonly seen in people with dementia. Wandering. People with dementia may walk aimlessly through the facility. As long as the person is in a secure area, this is okay. But if the person wanders off the property or into an unsafe area, the person is at great risk for injury. Remember, a person with dementia is confused and disoriented and unable to take the actions necessary to stay out of harm's way. Because this tendency to wander cannot be controlled, facilities have developed ways to allow the person to wander safely, including the use of sensors and fences. Pacing. A person with dementia may pace back and forth to the point of fatigue. Sometimes this is due to a need that has not been met, such as hunger or thirst, or the need to use the toilet.
How are you? I brought you your afternoon snack earlier. Don't you want it? No, okay. Would you like to go to the ladies' room? Let's go.
Another cause of pacing could be a noisy, overstimulating environment. Try to determine the cause of the behavior and take steps to relieve the cause. Sometimes there is nothing that can be done, and you will need to provide a safe environment in which the person can be allowed to pace. Repetition. A person with dementia may do the same thing over and over again, such as repeatedly folding a napkin or repeating the same phrase or question constantly. This is called perseveration. This behavior by itself is not harmful, but can be a sign that the person is bored. To break the cycle, try distracting the person by offering another activity, such as looking through a magazine or going for a walk. Rummaging. A person with dementia may go through drawers or closets searching for an item that he is never able to find. Ask the person what he is looking for and offer to help him find it.
Yes, but I don't think that's what you're looking for. Wait a minute. What about, is it this?
Rummaging can become a problem if the person is going through another resident's belongings. In such cases, try providing the person with a box or drawer full of their own personal items to rummage through instead. If distracting the person by providing an acceptable place to rummage does not work, it may be necessary to make certain areas, a roommate's storage space for example, off limits by locking them.
Come on over here.
Delusions. People with dementia may think they are someone else. For example, the President of the United States. A thought such as this is called a delusion. It is best not to try to correct the person, as correction will only upset him, because he really believes the delusion. Instead, try to redirect the conversation. For example, you might say, "Tell me about your day today." Hallucinations. A hallucination is seeing, hearing, tasting, or smelling something that is not really there, such as bugs crawling on a bed or table. Reassure the person. For example, go through the motion of sweeping the bugs off the bed, then gently redirect the person's attention. Agitation. People with dementia often exhibit agitation, becoming very upset or excited for no apparent reason. They might pace, shout, or strike out at caregivers or other residents. This is because they often lose the ability to communicate with others in more effective ways. Catastrophic reaction. A person with dementia may overreact to something that would cause a healthy person little or no stress. Such catastrophic reactions often occur when the person feels threatened or overwhelmed. Approach the person in a calm manner, using gentle touch, for example, or sing or hum softly to her. Sundowning. The worsening of a person's behavioral symptoms in the late afternoon and evening as the sun goes down is called sundowning. It is thought that fatigue, combined with poor vision as darkness falls, contributes to sundowning. You may help reduce sundowning by providing rest periods during the day and by turning on lights early as evening approaches.
Would you like to have a seat and we can discuss what we're going to do this evening?
Inappropriate sexual behavior. A person with dementia may make sexual advances toward a healthcare worker or toward another resident who is not her spouse. The person may also undress or even masturbate in public areas such as the dining room. These behaviors occur because the person is disoriented as to person, place, and time. As a healthcare worker, you must protect all of the residents of the facility from unwelcome sexual advances. Gently but firmly lead the person back to her room and redirect her attention by introducing another activity. It's important to note that behaviors such as these, when seen in a person who is normally alert and oriented, could be a sign of delirium rather than dementia. Delirium is a state of temporary confusion that frequently occurs as a symptom of an underlying disorder such as an infection or as a medication side effect. Be sure to notify the nurse immediately if you notice unusual behavior in a person who is normally alert and oriented. Behavior such as increased confusion, restlessness, agitation, or disorientation. Many behaviors associated with dementia are potentially dangerous for the person. Others are not dangerous but can be very annoying to others. As a nursing assistant, you must learn to redirect difficult behaviors in the most respectful manner possible. And to do this, you must know how to communicate with the person. Difficult behaviors that become worse or new behaviors that develop can indicate that the person is trying to tell you something. They're a sign that the person has a physical or emotional need that is not being met. Remember, as the dementia progresses, the person loses the ability to communicate effectively. In such cases, use your skills of observation to try and answer the following questions. What is the behavior? Who is the behavior associated with? That is, does the behavior occur only in the presence of a particular person? When does the behavior occur? And where does the behavior occur? Having answers to these questions can help you to answer the most important question of all. Why is this behavior happening? By answering that question, you can begin to respond to the behavior effectively. Once you have a few ideas about what is causing a behavior, you can try different strategies for modifying that behavior, beginning with meeting the person's physical needs. For example, if you suspect that the person is hungry, you can try offering a snack. Or, if you suspect the person needs to use the toilet, take the person to the bathroom. If you observe that there is a lot of activity and the room is noisy, you might try taking the person to a quieter place. On the other hand, if you suspect that the behavior is the result of pain or is otherwise related to a medical problem, see to the immediate safety of the person. Then report your suspicions to the nurse. Remember also that simple things such as poor eyesight and difficulty hearing can cause behavioral changes in people. If your resident wears eyeglasses or hearing aids, make sure that these devices are in place and ensure adequate lighting, especially in the evening. As you respond to behavior, it's important that rather than correcting the person, you try to distract her, while redirecting the conversation and the person's attention whenever possible. This is called validation therapy. Let's look at an effective way to handle the following situation. This resident is trying to leave the facility. She is very agitated because she thinks she has to go to the bank to cash a check.
Miss Shub, why don't we go down to the television room and see what's on this afternoon?
But I have to get to the bank before it closes.
Okay, but Miss Shub, today's Sunday, the bank's closed. Why don't we go down to the television room and see if your favorite show's on? You never miss your favorite show.
Oh.
Okay.
As you can see, the effective way to deal with a patient or resident who is agitated is to remain calm as you quietly redirect the person's attention. For a person with dementia, everyday activities such as bathing, dressing, eating, and using the bathroom can be very challenging. The person cannot remember how to do these things, may become very frustrated, and sometimes will resist doing what you need them to do. When you are assisting your residents with their activities of daily living, there are many approaches you can take to help ensure cooperation so that necessary tasks get accomplished. Let's take a look at some of the techniques you might use to assist a resident with dementia at mealtime. But first, a reminder. No matter what activity you are assisting with, be prepared and have everything you need for the procedure, including help if necessary, before you begin. This will help you to accomplish the task as efficiently as possible, which will reduce the amount of stress the person feels. And strive to keep a regular schedule. A person with dementia responds best to a very structured environment. As you assist the person with the procedure, be sure to keep reminding the person at each step what he needs to do next. Speak clearly in a calm tone of voice, and consider using hand gestures in addition to spoken instructions.
You want to cut up some more of your chicken now? That's it. Go like this. Good. Do good. Keep cutting.
Note how, during the meal, the nursing assistant gently shows the resident how to use his eating utensils, while leading him patiently through each step of the mealtime routine in order to avoid confusion. The nursing assistant's calm demeanor and patience and the quiet environment help to calm the resident, making him more responsive to the directions he is given. Helping people with dementia to meet their emotional needs is just as important as helping them to meet their physical needs. Like each of us, a person with dementia needs to feel loved and needed. Therapies that help meet these needs include reminiscence therapy and activity therapy. Reminiscence therapy encourages patients and residents to share their past memories and experiences. Activity therapy involves providing the patient or resident with activities that help the person feel useful and give him a sense of accomplishment. The activities can be for individuals or groups and are most effective when they involve participants in activities that relate to their former activities and interests. Activities are so important to the residents' well-being that many facilities display on the wall a large calendar with planned daily activities. Caring for those with dementia is for many of us the most difficult care to deliver. It can take its toll on us both physically and emotionally. People with dementia are frequently abusive toward their caregivers. This form of aggression, receiving verbal or physical abuse from someone you care for, can be very difficult to handle emotionally. Make sure you constantly remind yourself that the behavior is a result of the dementia and not a conscious decision on the part of the person suffering from the dementia. Such people cannot help the way they act. Many of the behaviors demonstrated by people with dementia can be very annoying, such as crying or repeating the same word or sound over and over again.
Your knife. Now hold it real tight. Here, Mr. Jacob. Let me show you. There.
These behaviors can soon begin to upset you. Caring for a person with dementia is also hard physical work. People with dementia require a great deal of physical care and may be uncooperative, making each task that much more difficult. You can become utterly worn out unless you take precautions. As you provide care for people with dementia, be sure to get the help you need, both physically and emotionally. If you find yourself becoming overly frustrated or angry with any person you care for, you may need to ask for temporary reassignment to another area. Each one of us has a breaking point. Be wise enough to anticipate where yours is and take steps to cope before you reach it. When you become tired or frustrated, take time out. Share your feelings with the nurse. Know that these feelings are normal. And know that in order to provide the best care for your residents, you need to care for yourself too. Finally, an important note of caution. If your frustration or anger moves you to the point of actually causing harm, you could lose your job, as well as all chance of future employment in the healthcare field. And that wouldn't help your patients or residents any more than it would help you. As patients and residents begin to lose their cherished memories, keep in your own mind the important role you play in the lives of those you care for. Always act in a way that is kind, courteous, and dedicated. In other words, don't forget who you are, a proud and dedicated healthcare professional.